السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة الاختبارات البرومترك. Review of Prometric Test Question. This is lecture number 3 in pediatric nursing. Today, inshallah, we are going to discuss 5 questions from question number 124 up to question number 128. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 124. A child with beta thalassemia is receiving long-term blood transfusion therapy for the treatment of the disorder. Chelation therapy is prescribed as a result of too much iron from the transfusion. Which medication should the nurse anticipate to be prescribed? The options are number A, fragmine, number B, meropenem, number C, metoprolol, number D, ديفروكسامين. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number D, which is ديفروكسامين. ليه اخترنا الخيار رقم D؟ نشوف rational. The major complication of long-term therapy, transfusion therapy, is hemosiderosis اللي هو iron overload. To prevent organ damage from too much iron, chelation therapy with either XJ or defloxamine may be prescribed. Defloxamine is classified as antidote for acute iron toxicity, so the correct option is option number D, which is defloxamine. Regarding to the option number A, fragmine. Fragmine is an anticoagulant used as prophylaxis for post-operative deep venous thrombosis. And regarding to the option number B, meropenem is an antibiotic, and option number C, metoprolol is a beta blocker used to treat hypertension. So the correct option for iron overload is defloxamine. ليه؟ لأنه defloxamine is antidote for acute iron toxicity. Question number 125. The clinic nurse instructs parents of a child with sickle cell anemia about the precipitating factor related to sickle cell crisis, which, if identified by the parents as a precipitating factor, indicates the need for further instructions. Option number A, stress. Number B, trauma. Number C, infection. Number D, fluid overload. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. Note the strategic word need for further instruction in red color. This word indicates a negative even query and ask you to select an option that is an incorrect statement. مطلوب منك تختار الخيار الخاطئ هنا. In this question, the correct option is option number D, which is fluid overload. طيب ليه اخترنا الخيار رقم D؟ نشوف rational. Sickle cell crisis may be precipitated by infection, dehydration, hypoxia, trauma, or physical or emotional stress. So the statement that, if made by mother, indicate a need for further instruction is statement number D, which is fluid overload. Because fluid overload is not a precipitating factor related to sickle cell crisis, but it is better for a sickle cell crisis or for a sickle cell patient to increase fluid intake. So the correct option is option number D. Question number 126. A 10-year-old child with hemophilia A has slit on the eyes and bumped his knee. The nurse should prepare to administer which prescription? The options are number A, injections of factor 10. Number B, intravenous infusions of iron. Number C, intravenous infusions of factor 8. Number D, intramuscular injection of iron using the track method. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C, which is intravenous infusions of factor 8. ليه اخترنا الخيار رقم C؟ نشوف rational. Hemophilia is bleeding disorder resulting from deficiency of a specific coagulation protein. The primary treatment is replacement of the missing collagen factor. Factor VIII would be prescribed intravenously to replace the missing collagen factor and minimizing the bleeding. So the correct option is option number C, which is intravenous infusions of factor VIII. Factor 10 and iron are not used to treat children with hemophilia A. So the correct option is option number C. Question number 127. The nurse is instructing the parents of a child with iron deficiency anemia regarding the administration of a liquid oral iron supplement. Which instruction should the nurse tell the parents? The options are: number A, administer the iron at meal time. Number B, administer the iron through the straw. Number C, mix the iron with cereal to administer. Number D, add the iron to formula for easy administration. وقف الفيديو هنا واختار الخيار اللي تشوفه سهل. The correct option is option number B, which is administer the iron through the straw. ليه اخترنا الخيار رقم B؟ نشوف rational. In iron deficiency anemia, an oral iron supplement is administered through the straw or medicine dropper, placed at the back of the mouth because the iron stain the teeth. يعني ياخذ الأيون أو الحديد بالماصة أو بالميديسين دروبر بالقطارة بتاعت العلاج وفي مؤخرة الفم لأنه الحديد بتعمل تغيير في لون الأسنان. So the correct option is option number B, which is administer the iron through the straw. Option number A is incorrect. ليه؟ Because absorption is decreased if there is a food in the stomach. Therefore, it should be administered between meal time, not within meal. Option number C and D are incorrect because iron is not added to a formula or mixed with the cereal or other food items. So the correct option is option number B, which is administer the iron through the straw. Question number 128. Laboratory studies are performed for a child suspected to have iron deficiency anemia. The nurse reviews the laboratory result, knowing that which result indicates this type of anemia. The options are elevated hemoglobin level, number B, decreased reticulocyte count, number C, elevated red blood cell count, number D, red blood cells that are microcytic and hypochromic. وقف الفيديو واختار الخيار اللي تشوف سهل. The correct option is option number D, which is red blood cells that are microcytic and hypochromic. ليه اخترنا الخيار رقم D؟ نشوف rationally. The result of complete blood count or complete blood cells count in children with iron deficiency anemia show decreased hemoglobin level and microcytic and hypochromic red blood cells. So the correct option is option number D. Option number A and C are incorrect. Why? Because the hemoglobin level and red blood cells count is decreased in iron deficiency anemia. مكتوب زايدة. And option number B also incorrect because the reticulocyte count is usually normal or is slightly elevated in iron deficiency anemia. So the correct option is option number D. شكرا جزيلا. نتقابل إن شاء الله في محاضرة جاية. Don't forget to support us by comment or like or subscribe.